which is also the first for sub-Saharan Africa. The health minister says the case is of an Italian national who entered the country from Milan earlier this week. Egypt and Algeria are the other African countries that have reported cases of the disease. The ministry said the patient was the patient is clinically stable and with no serious symptoms. Not critical, clinically stable with no serious symptoms. Let's bring in Phil Ihaza now, our correspondent in Abuja, Nigeria, for the latest. Phil, what are you learning this morning?
Well, thank you. What we know is that the coronavirus, which is also known as COVID-19 case, the first in Nigeria, has been confirmed by the Ministry of Health. According to the Minister of Health, Usagire Nahire, this on his social media, platform, he, has confirmed that a case. A coronavirus case has, been tested, positive in Nigeria, in Lagos State, southwest Nigeria, by an Italian businessman who entered the country on the 25th of February. He took ill on 26th, but of course he was confirmed positive of the coronavirus on the 27th, and therefore the minister has also assured Nigerians that he's in, at the moment, currently he's on a stable condition and he's being attended to at a medical facility in Lagos State.
So I was listening to the WHO director a couple of days ago. Actually, I read a statement, and he was talking about 41 countries now in Africa have laboratory capacity for testing of COVID-19. Basically, COVID-19 stands for coronavirus, disease 2019. So talk to us about Nigeria. Is Nigeria one of those 41 countries that are capable of testing for this disease?
Well, definitely Nigeria is one of those countries capable of testing for the disease, because according to the Minister of Health a few days ago, in fact, there's been periodic briefings to the media, to the populace, on Nigeria's preparedness to handle or contain or test for this disease. And that's why, of course, we have been able to confirm, this first case in Nigeria. This is not the first time, a case has been tested. According to the Lagos State government, 11 cases before now have been tested, but they were tested negative. Of course, that means that the country has the capacity to test, and of course also ensure that the victims are put in stable conditions at the moment.
Talk to us about, thermal testing at ports of entry, especially at airports. Has this been heightened since you have news of this first case?
Well, very, very true. The attention has been mostly on entry points and exit points in the country, especially at the airports and, of course, the seaports. The federal government gave a statement in January, not even now, far back in January, the fact that all ports, airports, have been placed on red alert to test for any possible case of the disease. Health officials, very, very experienced government health officials, as well as the WHO partners, have been at those places, ensuring that visitors or people coming into the country or leaving the country are properly tested for possible cases. And no wonder this case has also been confirmed. So definitely there's been that information, that Amber Alert raised even before now by the government.
So we're told by the World Health Organization that the incubation period for this disease is between 1 and 14 days for COVID-19. News trickling down to the people there. Phil, what sort of reaction are you getting from them?
Well, thank you. So far in Nigeria, it's been mixed reactions. I say mixed because, on social media, it's a buzz of activities. Even when you go on the streets, people are just waking up to the news of this development that occurred. Most of them woke up to the news today. And a lot of people are panicking, saying that, the country is faced with a lot already. And having to face this disease again is another, a huge one on the plate for the government, for the people to deal with. However, a lot of other people are optimistic that the fact that the country has been faced with a deadly virus before now, that's Ebola virus, and was able to withstand the outbreak, definitely this will also be taken care of. A lot of people, especially the government, have also called for calm, for the people to maintain some form of positivity and also increase or improve their hygienic conditions as they go about their daily